Did you know that nearly 1 in 5 medical claims are denied on the first submission? That's a major hit to any healthcare organization's bottom line. One denial that shows up more often than most and often causes most confusion is CO24. In this video, we'll be breaking down what CO24 really means, why it happens, how to prevent it. So let's jump into it. Denial code CO24 means charges are often under a capitation agreement or a managed care plan. Basically, the payer is saying the service you billed for was already included in the monthly payment arrangement, so you can't bill it again. With capitation, providers are paid a set amount per month per patient, no matter how many services the patient receives. So if a service is included in that agreement and you try to bill it separately, it gets denied. Now, this can happen for a few reasons. Sometimes the patient is in a capitated plan, but the provider or staff doesn't know or forgets and submits a claim anyway. Other times, the claim is set for the wrong payer. For example, billing traditionally Medicare instead of Medicare Advantage plan, that kind of pairing mismatch can trigger a denial code CO24. Another reason is a missing documentation like referrals or prior authorizations, which are often required under managed care. Or maybe the provider is out of network and isn't eligible to pay the bill at all. So how can you avoid CO24 denials? Step 1, confirm eligibility and capitation status. At every visit, verify that the patient's insurance is active and whether it falls under the capitation agreement. This helps prevent billing for services that are already covered under the monthly payment. Step 2, check the payer hierarchy. Use Coordination of Benefits, or COB, info to make sure you're billing the correct primary payers. Submitting claims to the wrong insurance is one of the easiest ways to trigger this denial. Step 3, know your contracts. Every capitation contract is different. Some services like labs or behavioral health might be carved out and billed separately. Keep copies of these contracts handy and make sure your staff understands them. Step 4, train your staff. Billing and front desk staff should know how to identify capitation cases, what information to collect, and how to handle them carefully. This reduces errors at every stage of the revenue cycle. But even if you do everything right, denials will still happen. So what should you do after receiving a denial code 24? Review the denial carefully. Look at the explanation of benefits or remittance advice to find out exactly why the denial occurred. Was it because the service was part of a capitation agreement, or was there a mistake in billing? Step 2, gather documentation. If you believe the denial was issued in error, like if the service was carved out or not covered under the capitation plan, patient eligibility, referral information, contract terms, and so on. Step 3, take action. If the claim was accurate and should be paid, file an appeal with all supporting documentation. If there was an error, correct it and resubmit the claim properly. Don't let it sit and stall your reimbursements. Handling CO24 denials is all about having the right processes in place. When your team understands the basics of capitation, confirms details up front, and knows how to follow up correctly, you reduce denials, protect revenue, and speed up payment. If you'd like to learn more about denial code management, reach out to eTactics. And since you made it this far into the video, you might as well like it, share it, and comment down below.